I have a few questions for you, and we would love to hear from the audience as well. Um, where do you see the priority for reimbursement? You mentioned adolescent health, which I am children, adolescent, that's one of the reasons I'm here. And I also created this symposium as well. They are our future and they entirely depend on adults. And one of the things that I see in my practice, because I'm a hospitalist and I see addiction at its worst, they come to us when adults have overdosed, they are on multiple different substances and they're still intoxicated and they're withdrawing. Some end up in the ICU, some end up dying. It's very, very heavy to see. And not to be able to do anything for them is very difficult. Where do you see, if there was funding, where do you see that, being most beneficial?
Um, well, prevention is ideal
Sure.
because that's what you want to do,
Right.
prevent the condition. Of course, once the condition is there, you need to treat it and you need rehabilitation. But I think prevention is key. And you mentioned, Dr. Fatemi, that you're a hospitalist. Well, sometimes we don't do screening in terms of substance use disorder. It's not only when the patients come to the hospital. One of the major reasons why patients are rehospitalized, I'm still focusing on medical conditions, is non-adherence to treatment and comorbid substance use disorders or comorbid mental disorders is one of the key reasons why patients, in fact, it is the most common reason why patients get rehospitalized. So I would move, that is going to be key, making sure that we do screening in all our patients and also plan ahead, sort of the treatment planning. If this patient suffers from condition X, diabetes, whichever medical condition, but also uses drugs or alcohol, let's just make sure that that patient gets care. Now, let me mention another thing that is key, and I'm going to focus now on behavioral care. Several times during my presentation, I mentioned the need for intermediate level of care. 10, 15 years ago, there was changes in terms of how intermediate level of cares were reimbursed. Many providers left the state, so that has been challenging. And so I think that's an area that we need to increase. We don't have enough intermediate level of care, and that includes partial hospitalization. It also includes residential. Now, we also need acute services. Unfortunately, substance use and mental health disorders can have lethal consequences. So we need to make sure that we provide that acute care, that we provide emergency services. So I'm kind of rounding up with something that I mentioned initially, which is a continuum of care.
Yeah.
So we can't focus on just
On just
one
one.
area. We need to focus on all of them.
Yeah, I agree with you 100%. I think that's a beautiful thing that the message that you're giving, and also a continuum of care as far as the age goes, not only for children, but also adults. And, I mean, all walks of life, we need all the help we can get in this area.
Yeah.
I'm really hoping that with everyone who is, I know some, potential legislators were going to be on the webinar today. And I think it's very important for us to truly focus on how we can help our population on a population level. I got my master's in public health too, and I look at everything more so now from a population level and where are we going, and we're not going anywhere good at this very moment. If
Mhm.
we continue the state, this current trajectory, we have choices that we can make maybe by funding, by bringing the community together to provide the mental health needs of our community. And yeah, thank you for that.
Yeah.
Anything?
Let me add something.
Yes.
Transition age, when a patient turns 18, it's like any other day, really, but not from the point of view of services, because patients who were receiving pediatric services, so to speak, or child psychiatric services, then the next day they need adult services. So we need to make sure that that we provide transition age, that it is smooth and the patient doesn't get lost. Unfortunately, well, the vast majority of psychiatric conditions actually starts under age 18. The vast majority, of course, dementias is not the case, but most psychiatric conditions start 18, and unfortunately, they don't go away. So we need to make sure that we don't lose focus on this transition age need.
Sure, sure. And do you see, and this, the reason I'm asking this is because I've done my own studies of original articles looking at childhood trauma and looking at adverse childhood events that have been showing an increase in number of adult this transition into addiction, PTSD, suicidality, treatment-resistant depression.
Yeah.
Yeah.
Well, trauma in New Mexico happens than in the rest of the country. And sometimes we providers don't ask about trauma. Can trauma produce psychiatric conditions and substance use disorders? And it's not that the yes or no, it definitely contributes. And actually, patients who have experienced trauma have a poor outcome, and again, both in substance use disorder and psychiatric conditions. That is something that also we don't do. We providers, we don't ask about trauma for different reasons, and then it doesn't get treated, and that actually will worsen the outcome. And there again, minoritized population have experienced more trauma, and also are less likely to be asked if they suffer from it or not. So again, I said sort of screening again and making sure that the treatment that we provide is comprehensive, that it's multidisciplinary. Patients do better when they have a team behind them as opposed to a solo provider. And multidisciplinary, of course, means people with different expertise. That's the other thing that I would emphasize. Back to you, Dr. Fatemi.
It takes a lot of collaboration and community work to be able to do this work. And that's why I'm so excited to do this work with psychiatry and internal medicine. We have presenters from family medicine and emergency medicine and addiction medicine, which is wonderful. We need all of us to join in and do this work. I love that you bring in that we don't ask about trauma. It's not even part of our thoughts, right? As physicians, the reason I even bring it up is because I've noticed my own traumas, right? As physicians, we have traumas that we accumulate over time, and then we add on the trauma of our patients and not knowing how to deal with that. So through my own personal journey of burnout and all of that, I was able to find ways, which I find it to be a gem. I'm very grateful for all of it, that now I understand where my patients come from. And in fact, I, have sat with patients and asked them, hey, what happened when you were a kid? And I shared my own trauma of living in war for the first 8 years of my life in Iran. And then they open up, but again, as a clinician, as a professional healthcare worker, you also have to be trained. What are you going to do with that information, right? It can be scary to have the patient share all that information with you if you have not dealt with your own trauma, and it can be a little too much, or it could trigger yourself. So this is why we need discussion and more conscious awareness of what is going on and how we can talk and how we can educate our community and how to approach these situations. Thank you so much, Dr. Tohen. Is there anything else that you would like to share?
Yes. I think that if we had needs before, our needs have increased.
Yeah.
And again, as I mentioned, we can't do it alone. We have to do it with the community, with the state, the county. I would say that the collaborations that we've had with the county, with the state, with the city have been very productive. And I think we need to do more than that. We need to do more of what you're doing today, Dr. Fatemi, which is education.
Yeah.
I'm sure some members of the audience, of course, many are providers, but maybe many are not.
Sure.
So that by educating the public, I think that that's something that we can't forget, and that's an obligation we have as the only academic center in the state.
I agree.
Thank you again, Dr. Fatemi, for having me here, and thank you, folks, for joining us on a Sunday.